Hello, students. So I'm going to do some virtual lecturing today since we're having a snow day tomorrow. They haven't officially called it, but we know that it's coming. So here's the lecture you would have gotten on Monday. First, I'm going to start off with talking about the oral pathology project. I know I went over it a little bit in class, but as you can see on the screen here, please go down to assignments, oral pathology project. Please sign up. You should have signed up through Sign Up Genius already for your pathology. If you have not, it's past due, so please do that. Some of you have not looked at the announcement that I sent about that project, so that's why I'm just briefly going over it. And the project's due to be uploaded March 15th, so you have some time. The directions are at the bottom, and there is a sample project there. So please get working on that if you have not already. We will have our exam that was scheduled for today in class next time we are together. So that will be on all information up to last week. So I will not include this information since it would be a lot to kind of go over, but there'll be anatomy and physiology and microbiology, medical histories, medical emergencies, and vitals. Study that for your first exam. For this lecture, we're going to go over, I believe it is 4 topics. So let me pull them up now and we will talk about them. And it includes diabetes, nutrition, autoimmune disorders, and oral pathology. So kind of a lot. And that is why missing out on another Monday is so incredibly sad. All right, so I am going to start off with let's go with autoimmune. All right, so autoimmune disorders, and I know I talk a lot personally in this class, and I do have an autoimmune disorder, and we'll go over it. But sometimes just because somebody looks okay from the outside doesn't mean that they're not struggling with something, especially autoimmune. So there are a lot of diseases that we're going to see that and disorders that our patients might be struggling with. But again, at a first glance, they might not look like they are sick or have some kind of issues. But immune dysfunction is when, there's usually a genetic predisposition or an environmental trigger, but it's your own body working against itself. There's communication within your body that is misfiring and it thinks you are sick and starts targeting what it thinks is sick and it's targeting your own body. There are, antibodies that bind to antigens and they form immune complexes and they circulate with antigens, right? So our body is constantly working on this. Think about all the bacteria that is in our mouth, good and bad. Our body is always trying to delineate which one's good, which one's bad, and our immune system is kicking in. So especially when someone is neglecting their oral health, the immune system kicks in even more. So we're going to start to see complications orally that we wouldn't typically see when they are dealing with immune system issues. But there are some common characteristics to having an immune disorder, an autoimmune disorder, and that's cluster disorder. So it's not always just one issue. It could come with 2 or 3 issues. And each one individually is hard to diagnose because there's overlap. So it might be multi-system organ involvement, nondescript signs or symptoms, again, that may not be easily diagnosed, and psychiatric difficulties. In dental hygiene, really, in a lot of different professions, we use ADPI. Because there are more than 80 different autoimmunes, so really we have to assess the patient, diagnose, plan, implement, evaluate, and document. So this is what they're going through. And sometimes they're going to guess at something or do a differential diagnosis and, cross it off the list and go from there until they find something that makes sense. And that's why having an autoimmune disorder can be so exhausting. While through ADPI, data assessment and diagnosis phase is really important and takes sometimes the longest. They're going to run tests. They might do blood panels. They might do how the patient's feeling. They might have a history of complaints going on. And then that final diagnosis is really key, even if it is, differential diagnosis, or that just having a diagnosis when you have an autoimmune disorder can be so helpful, because then that'll lead you to how you're going to treat it and gives that patient an explanation of why they're feeling the way they've been feeling. With planning, evaluation, and documentation, a lot of autoimmune disorders, or the medications that treat these autoimmune disorders, will affect oral health. And like I said, sometimes we see these autoimmune issues orally before the patient even knows what's going on, and we'll talk about those. But there might be some different stages to that that we'll see them in the dental office because they've been diagnosed. We know what's going on. They start getting medicated. It might cause dry mouth or gingival hyperplasia. We might be having these patients come to preventative appointments more often on 3 or 4 month recalls. We might be seeing them more often to do fillings and things like that. So again, when our patients have autoimmune diseases or disorders, you're going to see them a little bit more frequently. And they will be prescribed sometimes medications, right? And this is going to help with pain they might be feeling or function, right? So even thyroid disorders create extreme fatigue. So they're just trying to not be fatigued all the time. They might slow down the disease progression and reduce the tissue destruction. But again, these medications will have side effects that can be seen orally. The folks that have autoimmune might be prescribed anti-inflammatories, so NSAIDs, corticosteroids like prednisone or prednisolone. You might see them on pain medications, anti-rheumatic medications, anything that's listed there. And again, there's a really good graph in your book. But almost all of these can cause dry mouth. So that's what, anytime my patient has an autoimmune disorder, I'll ask them, are you experiencing, or how often do you experience dry mouth? Some pretty frequent autoimmune disorders you'll see are adrenal gland diseases and syndromes. So we all have adrenal glands, and if they are not firing properly, either too much or too little, can have an effect on the rest of the body. And we've talked about this throughout the semester, but having, homeostasis, right? Like when one organ or issue is happening, it's going to affect the rest of the body. But Addison's disease is when there is too much adrenal gland production, too much, and you can see intraorally, there's different pigmentation of the skin. So you'll start to see discoloration on the buccal mucosa and on the soft tissues. You might see it in the hands or even feet of the patient. They might have sunken eyes, sweating, low blood pressure, weak pulse. They might look bluish, nausea, vomiting. So you can see all of these side effects and symptoms of adrenal crisis, right? So their adrenal gland is pumping. In children, this will cause the puberty markers to start early. So it could kick off early puberty. But so hyperadrenalism, right, could also be Cushing symptoms, right? So high adrenaline, you can see that hump on the back, a moon-shaped face, right? So this is the picture of the woman on the left-hand side. That's before and after, right? So that was before diagnosis and after diagnosis of Cushing syndrome. So getting that, I mean, what a difference, right? And that hump, I mean, sometimes I'll see people walking on the street and I can tell right away that they have Cushing's because of these telltale signs. A lot of thyroid diseases. So if you don't know, your thyroid is in your throat. It is on in front of and on the sides of your trachea. It can produce a goiter if there's too much thyroid hormone being produced, which is a bulging. And that's why when our dental hygienists and dentists do intraoral, extraoral exams, they feel on the thyroid and on the sides and have them swallow. They're looking for differences around that. And there are millions of people with thyroid disorders. This is one that is becoming more and more and more common, especially with folks that have had to deal with radiation, or even folks that are in Poland or Ukraine, or even when Chernobyl happened, that radiation came all the way over to the United States, and we saw an increase of thyroid disorders. So this is something that we frequently see. This is something that I have been affected by, right? So I have Graves' disease, and we'll talk about that, which is a thyroid disorder, but I've had my thyroid radiated. So some of our patients are going to be coming in in the beginning or the middle or end of treatment. And again, when we do our head and neck exams, they might doctor might notate a goiter or a enlarged thyroid gland. But there is underactive and overactive thyroid disorders. The hypo, which is underactive, and hyper, which is overactive. And that hyper is going to affect mostly women, for more women than men. And the most common form is Graves' disease. And hypo is under reactive, right? Not enough hormones, and can be affect the central nervous system. These folks might be on, they're on lifelong medication to correct this, but there's going to be different signs or symptoms for that. So I luckily did not have these side effects, but with Graves' disease, the thyroid is pumping too much thyroid hormone. You can see people with bulging eyes, that goiter or inflammation or swelling of the thyroid gland. These folks run really hot. They might have anxiety, and there's thyroid storms where it's almost like an anxiety attack, but it's actually just part of the thyroid and the hormones. And thyroid has so much to do with the hormones and just how the body is regulated. So they might be wired, almost like they're on too much caffeine. They might not be getting REM sleeping because their sleep is being disturbed. So they think they're sleeping, but their body's kind of still going. Hashimoto's is another thyroid disorder. So folks that have Hashimoto's might have infants that end up with cleft lip, higher risk for cleft lip or cleft palate. They have enlarged hypofunctioning goiter, right thyroid, so under functioning. There's a lot of folks that have been, this diagnosis is increasing and increasing. And then with hypothyroidism, so when somebody has hyperthyroidism, a lot of times they do one of two treatments. They'll either remove part or all of the thyroid, or radiate it using radiation, right? So then for the rest of that person's life, they're on medication to control that thyroid. And when people have too low of thyroid hormone, they're going to have fatigue, like just so tired all of the time, and a lot of other side effects, right? But they're going to be controlled by medications. Hyper, you can have cardiac issues like heart palpitations, or they might be on beta blockers to slow their heart down. So again, there's, a lot of folks go from one extreme to the other. They've had hyperthyroid, then they have it treated, and then they have hypothyroid. Systemic lupus erythematosus is another autoimmune disorder. There's some telltale signs, like that butterfly patch that's on the middle picture. When you see that rash on both sides of the face, that is a pretty pretty good sign or symptom or classic symptom of systemic lupus. You might see lace-like lesions or lace-like white patches on the patient's buccal mucosa. Again, and this can only be diagnosed if they have it orally. We would send them to a oral surgeon for biopsy for that tissue. And sometimes they come back with, oh, they have to see their primary care, and it's actually lupus. Um, Chronic cutaneous lupus, again, you're going to see that dryness or scaling on the nose and fingertips. Sjogren syndrome can be brought on, is autoimmune, but also can be brought on through medications or some treatments when you're getting treated for other things. But Sjogren's is dryness, like everything in the body is dry. Eyes, mucous membranes everywhere. And it is so dry, it is uncomfortable. So think about our folks that have dentures or partials. They're going to have a hard time wearing them or speaking or eating because their saliva helps with the digestion process. But this is so super uncomfortable, and they're at a higher risk for decay, such a high risk for decay, and even exacerbation of periodontal disease, that these folks need to be on all sorts of preventatives for dry mouth, because their glands are not working properly. You might see some scleroderma. This is also an autoimmune disorder. Unfortunately, this does not get enough recognition because not enough people have scleroderma for there to be a lot of money in research. I do have a friend of mine that has scleroderma, and I've had patients who have had scleroderma, and to the point where what this is the connective tissue starts hardening and they become inflexible. And it happens when it happens. It can happen very quickly. You can see in the picture there's some the connective tissue, right? The ligaments around the tooth start hardening, and it can have some oral complications. Their hands and mouth, any of that tissue starts to shrink and close and harden, and it makes it hard for those folks to have mobility, to hold a toothbrush. My patient that I was seeing, and I was bringing her in every 3 months, I could not get a sensor in her mouth. Her mouth was so, so such a small opening that we finally just had to do a pano for our needs, and she was at a higher risk of things. These folks have almost like arthritic issues too, because all that connective tissue is hardening. They are just sore in all of their joints. It's very sad, and there's not enough funding for this to find a cure because not enough people have it. But I'm seeing this more and more so out there. And it happens really rapidly. They can have regular features look like themselves, and within a year go through where things start hardening and shrinking. Those connective tissues are affected. Sarcoidosis, again, you might see inflammation of the tissues. Pemphigus vulgaris, this is something that I see and I have seen dentally a few times. This is painful. So they have painful ulcers. The tissue almost wipes away. It's very fragile. They need to go to an oral surgeon and have a biopsy. This is autoimmune and has a lot to do with vitamins and minerals. And again, it's just so these folks will come in and have kind of ulcers everywhere, and they don't know what kind of triggers this, right? So we try to tell them to stay away from acidic foods. This person, the denture was rubbing up and caused a flare-up of pemphigus vulgaris. But I've had a patient, every time he came in, he had severe ulcers everywhere. So we were, there wasn't a cure, but we were palliatively treating him with a magic mouthwash. And that is something that will numb up the tissues and help. And he was seeing a nutritionist and again, trying to figure out how to get this under control. Pemphigoid, there's a couple of different pemphigoids, but you can see there's red, irritated gingiva. This is also very painful. Even just touching it might cause a flare up. A chip hit your gum or tissue in a certain way and then start a flare up. But pemphigoid is again hard to diagnose and needs to be sent to an oral surgeon for diagnosis. So that is autoimmune. There's a lot more autoimmune diseases out there. I highly recommend you taking continuing education classes. And we're going to roll right into diabetes because diabetes too has a lot to do with the immune system and with the way your body functions, right? So we've talked about diabetes kind of almost in every class it has come up. But it is a chronic disorder of the metabolism that alters blood glucose through the use of insulin, right? So your insulin is either underproductive or the sugar is too high and the insulin is there's too much insulin or not enough insulin or too much blood glucose or not enough blood glucose. And folks with diabetes will see an endocrinologist, like just like some of those folks with autoimmune disorders. But there typically are four stages of diabetes. You can have pre-diabetes, right? So a patient that's coming in and they're not quite diabetic, but they see it coming, right? And these folks are, even though they're not diagnosed with diabetes yet, they are at a higher risk for heart attack and stroke. Their body isn't processing the sugar. This is a really good point where these folks can change and not become diabetic with lifestyle change. There's type 1. They used to call type 1 diabetes juvenile diabetes. But there's been a lot of research and folks that are older may be diagnosed as a type 1 diabetic. So it's not always just discovered in when they are young, but for a lot of folks, this they will discover kind of right away because it starts destroying their own body, right? The autoimmune issue is destroying the insulin producing cells in the pancreas. There are less type 1 diabetics and they need daily insulin for survival. So monitoring and keeping up with their nutrition and their insulin rates, this is really, really important. And they will know more, type 1 diabetics know more about diabetes than any of us really ever will, because this is something that affects their day in, day out lives. Type 2 diabetes is the most common form. It's non-insulin dependent. Their bodies have an inability to make enough insulin. There's a lot of multiple risk factors for this. A lot of folks, they're older, they're overweight, obesity has a lot to do with it. Their body is not able to keep up with the amount of sugar that is being taken in. And then their kidneys will have an issue as well. So type 2 is the most common. So you'll see folks on metformin and a lot of other medications for this. These folks too should be changing their diet and lifestyle, but it's easier said than done. And there's a reason why these folks ended up, for the most part, diabetic to begin with. There's gastrointestinal as well, gestational pregnant diabetes. So folks that are pregnant are at a higher risk for type 2 diabetes. Sometimes this will go away after they've given birth, and sometimes it does not. But the OBGYNs and the doctors that are, seeing pregnant patients check this. Every single pregnant patient gets checked for gestational diabetes because it can have long-term effects on the mother and on the fetus. There are a lot of risk factors for diabetes, right? So I already talked about obesity. There's physical inactivity. So somebody who is not mobile, they're higher risk in certain ethnic populations. For folks that have blood pressure that's over 140 over 90, cholesterol, high cholesterol levels, and family history. So there's a lot of different factors. And for this, we can never tell, is it like cart before the horse? If somebody who is inactive and has an obese diet, um, they're more prone to hypertension, right? They're eating bad foods, high salt intake, things like that. So they're already prone to the higher risk for hypertension and high cholesterol. So it's not necessarily one is causing the other, but it's that patient's lifestyle that's creating all of these issues. And about 1 out of 10 adults in the world have diabetes, right? So, and a lot of folks are not diagnosed yet, but if this goes uncontrolled diabetes goes undiagnosed for too long, they end up in the emergency room. So you can see this map here. It shows you where it's most prevalent in the United States. See those southern states? The obesity rates in those southern states is very high. Everything is cooked in butter and lard, and these folks have the highest rates for diabetes and being overweight. So there are a lot of, or used to be a lot of programs that would really target these folks to try to get them more nutritional information, healthy eating habits, exercise plans, right? So there was a lot that was going into changing that, but change is very hard for some folks. There are a lot of treatments for folks who have type 1 diabetes and type 2 diabetes. Type 1 diabetes, again, is a exercise and their nutrition, making sure that they're eating the proper amount of sugar and proteins and essential vitamins and minerals. They need to be testing often and staying within a good range. Now, a lot of these folks will have the implanted trackers, and it goes right to their phone for type 1 and type 2 diabetes, and it'll tell you what their sugar levels are or their insulin levels so that they can, nourish themselves as needed. There are a lot of different medications for type 2 diabetes. And again, you'll start to get privy to them. The folks will come in, they'll talk about metformin and again, just different medications. There's a whole lot of them out there, and you'll start going, oh, I've heard of that before. And when we have people with diabetes patients and we're doing their medical history intake, we have to ask them what their blood sugar was. And if they do not know, some of the offices make it mandatory now to take the blood sugar before procedures, because that's how important it is. One, you don't want to have a medical emergency. And two, patients with diabetes have slow wound healing. So especially if they're getting extractions or things like that, that can be really affected. Some symptoms of type 2 diabetes, weakness, slow healing of wounds, consistent feeling of hunger, frequent skin infections, again, that aren't healing, dry mouth, frequent urination, numbness and paresthesia of the legs. They'll feel like tingling in the legs, visual impairment, and strong thirst. And diabetes and oral health are directly connected. This we do have a lot of research on. And the amount, when we see somebody who has periodontal disease, gum disease, we're going to see their diabetic numbers, their A1C, and their sugar levels being out of whack. And same thing if their sugar levels or their A1C is, their insulin is uncontrolled, their diabetes is uncontrolled, we start to see flare-ups of gum disease. It is hand in hand, right? So, and if you get an infection because of the diabetes, and what is an infection, right? Cavities is an infection, gum disease is an infection. It takes longer to heal, right? So, and you're more likely to develop that. So definitely take I take courses every year on diabetes and do a deep dive, but it has a lot to do with even your saliva, the sugar amounts in your saliva that come out. But it's very, very interesting. So again, this is just an overview of how the diabetes can affect oral health. And when we have patients that are coming in, especially if they're uncontrolled. One, we might be, or your doctor might ask you to call the endocrinologist. If they are completely uncontrolled diabetics, they might need actually pre-medication before their appointments, especially if they're getting extractions. They might need sedation. They definitely need nutritional counseling, and the hygienists are trained to do that. So they might need another extra appointment. They might be being seen when they are seen. We might be getting that reading for them, and that's now a billable process. So again, depending on your office, they might have you put in for that for the insurance. All right, so that was diabetes. Rolling right into nutrition, which goes right along with diabetes. But nutrition is its own class, right? Many of you have hopefully taken nutrition or will take nutrition. I think at this point, almost all of you have, if you're not taking it this semester, but you needed to graduate. So you're going to go way in depth in nutrition. But what the nutrition department and the nutrition courses in STEM don't really focus on is how it's directly connected to oral health in so many ways, right? In gum disease, in cavities, in anything, right? Nutrition is a huge part of that in oral health. So you really, it's for development, growth, repair, and maintenance. And a lot of times when we have extractions, or the patient has an extraction, or has scaling and root planing, or you can see even here, just think about the teenager, the person that's in braces, people who are missing teeth, how their nutrition can be affected. And if we're not eating or consuming the right nutrients because of the things that we are going dentally, our teeth aren't going to be as strong, our healing won't be as quick, and there'll be more issues that will trigger, right? So it's like a cycle, right? You having tooth or gum disease because of the nutrition, and then you have it treated and you have nutritional issues. So there are a lot of situations where you might, and I hope some of your offices are getting really good with keeping pamphlets to maintain proper nutrition. And all of the hygiene students take a whole, or used to at least take a whole course on just oral nutrition and not just overall nutrition, and be able to counsel folks if needed. But there is a new Healthy People that is, and I don't even know honestly if there's still, we have Healthy People 2030. It was through health.gov, which is a government resource. I'm not sure if that's still up and running because of this administration, but there used to be some really great resources. But Healthy People would look at public health and say, okay, what are the major issues in public health and how do we respond to them? And nutrition is always a consideration in that. There's also myplate.gov, which talks about, and again, I'm not sure if that's even active anymore. I'll have to check. I do know this current administration redid the food pyramid and like kind of threw science out the window. And it makes no sense. So again, I mean, I used to really rely on the scientists and the government websites, but you know me, I could go down a hole with this, but right now not as reliable. So maybe go look for historical information on health and diet, because there should be a certain amount of your diet that comes from carbohydrates, fats, proteins. You need certain minerals and vitamins. If you're not getting them naturally, they need to be consumed. But there is and it can be different for every single person. So that's why there's ranges. But there is a diet, you know, the Mediterranean diet is a really good one, but the American diet is awful, right? So we have more obesity than any other country. So we try to combat that by educating people to even just look at nutritional labels. And we'll talk about it, but nutritional labels were really misleading and hard to read. Even the servings were off. When you looked at it, or you went to a restaurant and you ate a Big Mac, you didn't know there was 2,500 calories in that one sandwich, which is more than a day's worth of calories. So they came up with the RDA, recommended dietary allowances. And these are based on the amount of essential nutrients needed on a daily basis to prevent a deficiency, right? So even myself, I'm taking all these supplements and vitamins and minerals. I was deficient in like vitamin D, so I started taking supplements, but some folks take like too many and then just have really expensive urine. So it's knowing where your levels are, supplementing them if needed, and not overdoing it. So some folks won't have that blood test or that testing done. They don't know their baseline and they just take supplements um, without rhyme or reason and end up with taking too much. So always consult with a nutritionist or a primary care physician or somebody who is licensed to do that. You better believe you need to memorize this. There are 6 key nutrients, and we're going to talk about each one, but everybody needs to have, in one way or another, carbohydrates, proteins, fats, water, vitamins, and minerals. That is going to sustain life. With carbohydrates, it's the body's main source for energy, right? So we have simple sugars, complex carbohydrates, or dietary fiber. So simple sugars, you're going to think cookies, candies, white bread, syrups, right? Empty calories, things that are junk and sticky, and these things are going to cause these types of carbohydrates are higher risk for causing cavities because they get trapped in the teeth. I know so many folks have talked about this before that grew up in a different country, made their own breads, and then they come over here and it's cheaper to buy a 99-cent loaf of bread, but it's packed with sugar and they end up with a ton of cavities, right? So there's just so many simple sugars that are in, especially packaged foods or foods that you're purchasing in the store. Then we have complex carbohydrates. So that supplies vitamins, minerals, fiber. They must be processed before they're absorbed in the intestines. They keep you feeling fuller longer, right? So these are whole carbohydrates. They're found in grains, even vegetables and fruits. So when somebody is allergic to like gluten, you think, well, they're allergic to carbohydrates. No, carbohydrates are in vegetables and fruits as well, right? Our body breaks it down and makes it a carbohydrate. And gluten is just a type that is found in breads and things like that. We also need dietary fiber. It cannot be absorbed. It's beneficial for normal gastrointestinal functions. It helps lower cholesterol. It reduces the risk of cancer and heart disease. And you're going to find this in oats, bran, fruits, veggies, grains, and beans. Proteins. Everybody needs protein, especially for your oral health. This is found throughout the whole body, right? Our muscle, our skin, our bones. It's composed of amino acids, and those help to build and repair tissues and can be classified in 3 different ways: complete, partially complete, or incomplete. Complete is a mixture of all 8 essential amino acids that make a new protein. It supports life and normal growth, and it's found in meat, fish, poultry, eggs, and dairy products. Partially complete is unbalanced, right? So it will maintain life, but not support growth, right? So you're going to find that in grains and in vegetables. And I'm just looking something up right now. So bear with me. But there are 9. That's a typo there. I knew there were 9. So there are 9 amino acids. And I'm not going to have you memorize them. I used to, but it's histidine, isoleucine, leucine, lysine, methionine, phenylalanine, threonine, tryptophan, and valine. There are 9. So if you see on a quiz how many essential acids are there, amino acids are there, it is 9. And then incomplete is missing one or more of the essential acids, and it won't support life or growth. So corn and gelatin, you cannot have a diet just straight based in corn or gelatin. You're going to end up with a deficiency. So although it does and can contain protein, it is not enough to have an effect on the body. Fats are super important. Fats do a lot. And I'm going to ask you in a quiz and maybe on the midterm some of the functions of fats, right? So it supports energy, it provides essential fatty acids, provides heat insulation, components of cell membranes and coverings of nerve cells. It's cushion, it protects your internal body organs and transports vitamins. So lipids or fats is really, really important. And you can have folks, especially those that have eating disorders where they're avoiding fatty foods. And again, there's going to be healthy fats and not healthy fats, but they will have an eating disorder. They think they're really healthy. They're like, yeah, I don't eat fats. I don't eat, yeah, but they're depriving their body of some of these essential nutrients, especially those are anorexic and bulimic. And anorexia, we'll talk about this down the line, but even if they're depriving themselves of what they think is not good fat and they're not getting enough fat, that can affect their heart and liver health. But mostly we see it overdone, especially in this country, right? So it's not typically under eating of the fats and lipids, but it's overeating of the fats and lipids. You're going to have for cholesterol, HDLs and LDLs. And HDLs are good fat that comes from poly and monosaturated fats, and LDLs is bad fat. So when they run their cholesterol levels, they're looking for both. And if you're going to have too much of the good fat or too much of the bad fat, not enough of the good fat and too much of the bad fat, they're going to try to put you on a healthier diet. So talking to a nutritionist and or then they'll put you on statins. So a lot of your parents or folks who are older end up on these statins, and it could have a genetic component as well, but that is what they are looking for. But overconsumption leads to obesity, diabetes, cardiovascular disease, and cancers. So again, overeating can lead to a lot of health issues, and undereating can also lead to a lot of health issues. It's all about that homeostasis, getting it just right. So vitamins are super important. They do not supply energy, but they're needed to release energy from the carbs, fats, and proteins that you've also taken in, right? So if you have a vitamin deficiency, you are not going to be able, your body is not going to be able to release that energy from the things that are giving you energy. So it could be vitamins can occur in plants and animal tissues. Some of them will function as enzymes in chemical reactions. There are 13 vitamins that have been discovered. 4 are fat soluble. So vitamins A, D, E, K, they're stored in body fat and not destroyed in cooking, right? So they can tolerate high heat. And 9 are water soluble. So our vitamin Bs and vitamin C, it's not stored in the body, and we must be consuming them daily, right? And they are easily destroyed by food preparation, right? So they are not heat resistant. If you're cooking something and heat it too high or boil something, you will destroy the vitamin B and C. So we need to consume those. That's why you'll see a lot of foods are fortified or have additive vitamin B and C. Minerals. There are 14 essential minerals, and essential means that you need them. You must have them to maintain health and function. They must be supplied by the diet, right? You're not getting them anywhere else but consuming them. And they are found in all foods except those that are highly refined, right? So highly packaged and processed. Minerals that are needed in larger amounts to maintain health is sodium, potassium, calcium, chloride, phosphorus, and magnesium. And you should have heard of some of these in depth, especially since teeth are made out of a lot of these, right? Calcium and phosphorus and potassium. So we need these, especially for oral health. And when we are deficient in some of these minerals, you will start to see that breakdown of the teeth and gum tissue. Water is so important. You guys know I don't drink enough water. Even right now, I'm drinking a big old coffee. But your body is 80% water. It helps build tissues. It regulates body temperature, lubricates joints and mucous membranes, right? Without water, we would die. Electrolyte imbalances can be life-threatening. So if too much water is lost through diarrhea, vomiting, or burns or excessive perspiration, you can have a lot of issues. And that's why a lot of hikers or athletes will add electrolytes to their water. It's approximately 91 ounces is needed for women and 125 ounces is needed for men on a daily requirement, depending on body size. But I've seen that number fluctuate. When growing up, they used to say, oh, you have to drink 8 glasses of water a day to be healthy. And that was a myth. And any of you who have, I don't know if anybody in this class, but the next class, I've taken my Bio 120 course, you can also drown or basically overdose from having too much water, right? So again, it's all about balance. Uh, Folks that need nutritional counseling, especially in dentistry, the hygienists are trained to do, you know, very light nutritional counseling. They will have them do an, a journal. Some of you might have had to do this in nutrition, but you do a 2-week journal. It's everything that they're consuming. There are some apps, there's some programs you can put it in, and they'll tell you exactly what their nutrition in, whether it be proteins or vitamins or what minerals, just from what they're intaking. So it's a way you can get that information without running a complete blood count. Your doctor can run. But these analyses can be very instrumental in helping the hygienist choose prevention or see why somebody might have an increased amount of dental cavities, right? Because we'll talk a lot about, exposure. So every time they eat or snack, the acidity of the mouth goes up, the bacteria loves it, and there's no buffer time, right? So somebody who is a picker throughout the day is going to have more cavities than somebody that is kind of getting all of their food in one sitting and then neutralizing their mouth by not snacking or drinking anything after that. But even though we might have this information, this background in nutrition, it does not make us a registered nutritionalist. So that is a specific degree and certification that folks can go out and obtain, right? It's more schooling, and we will always rely on those folks. So sometimes when it is too much of a case for us, we will refer them to a nutritionalist. But for the most part, a lot of the dental hygienists and the dentists are trained in doing oral diagnoses and can help with nutrition. I talked about food labels a little bit earlier, but these have changed a lot in the last about 5 to 10 years. There's now a requirement to have individual serving sizes listed on there, the total calories, how it's going to affect our RDA. It needs to be easy to read. Again, for a long time, these were really convoluted. You would look at a nutritional label and you wouldn't even really be able to tell how much you were consuming unless you had a really good grasp of nutrition. You can see the difference between the label on the left and the label on the right. And at a glance, you should be able to really take away some of that information. So even folks that don't have, a degree in nutrition can figure out what they're putting into their bodies. So trigger warning here. We're going to talk about some eating disorders, especially anorexia and bulimia. But anorexia is self-starvation. It becomes malnourishment, muscle wasting. amenorrhea, which is lack of menstruation, brittle nails, constipation, and can lead to death. So a lot of folks who are anorexic are depriving themselves, and it might not just be all foods, might be some of that essential food, but they are self-starving, right? Restricting, too restrictive. And it is leading to some poorer health outcomes. And then you might see some folks that have bulimia, which is self-induced vomiting. It gives you severe erosion on the linguals of teeth, especially on the posterior molars. These folks lose electrolytes and can also lead to death. And I'll tell you, the folks that are bulimic, they're binging and purging. They're typically overweight. This is something that you'll see in folks that are still overweight. So it's a psychological issue where they feel guilty for what they have consumed and need to get it out, but they're still consuming it. You will see this, and this becomes really hard conversations in dentistry because you will see the wear on the teeth and increased decay. And I mean, you just as a dentist or dental hygienist, you just have to come out with it and say, do you vomit a lot? Or do you have acid reflux? Or is this, so this is something that you have to look for and have these hard conversations. They might not say anything to the doctor or the hygienist, and as soon as they leave the room, they might have more of a connection with you and confess this to you. So there's not a whole lot that we can do except help them if they need help, refer them to get mental health counseling, get nutritional counseling, talk to them about the effects that it's having on their teeth. But a lot of these folks do know. And then some that are in recovery, right? So they could have had this when they were younger. You're always going to be affected by this and at risk for relapse. But they might be coming to the dentist because they're trying to change and improve or dealing with this. And it's for us to kind of really help them with prevention. There are 5 healthy habits for a long life. It's just eating right, keeping the bone strong, protecting your immune system, maintaining a healthy body weight, and exercise, right? So easy to say, really hard to do, but once you get into the habit of nourishing your body with not junk from a bag or something that's processed, your body does feel better. There are a lot of tables in your book that are really useful, so you can take a look at them. But that is it for nutrition. I believe there was one more. Lecture. Yes, there was oral pathology. So let's take a look at that. All right. So this is going to be kind of a review, right? So we talked about this kind of throughout the semester and a little bit last semester, but pathology is really important. And we will not be diagnosing anything. The beauty of being a dental assistant is that is really up to our dentist to do. And even our dentists are not able to diagnose a lot of these things because they have to have a biopsy. Some general practices might do biopsies, certain kind of biopsies, but for the most part, they will refer them to an oral surgeon to get that pathology. They will take samples, send it to a pathologist, have them read, and given back to you. So if you're working in oral surgery, this is something that you're going to have to deal with a lot. But pathology is a study of diseases in the oral cavity, right? Any disease can have some oral pathology to it, but only a pathologist or that oral surgeon can diagnose. And our role is the difference between what is normal and what is abnormal, because more eyes on something is better. If you see something, we typically sit to the left of the patient, And you might see something on tissue or on teeth that your doctor might see, and you give them a heads up. And they, look at an abnormality, and anything in the mouth should heal within 2 weeks. And if it still hasn't healed, then further diagnosis needs to happen. But again, we need to know what abnormal looks like. You really need to know what normal looks like so you can tell the difference. But at the end of the day, it'll really be up to our doctors. But you will be assisting them in doing this. You might be recording the lesions, and they're going to talk about shape and size, color, and location. And that all needs to be documented, not only in the note history, but also in by pictures and by scans and x-rays. So that is something that you'll be assisting with. But to make a diagnosis, you need several pieces of information. You can see that these are bolded. So guess what? These are probably going to be on a quiz and a midterm and a final, right? But there are different ways to diagnose: historical, clinical, radiographic, microscopic, through a laboratory, therapeutic, or differential. And those are all part of an accurate diagnosis. So when we are collecting data, right, so we need to know, there's going to be a lot of questions. And I just got the message that we are canceled tomorrow. So it's great that I'm recording this. Okay, so you need historical information from your patient, their personal, family, medical history. Are there any genetic disorders? Is there any common occurrences? Does whatever that is abnormal, what is the color, size, shape, location? Right? So like if somebody has a fissured tongue, what does that look like? Being more descriptive is always best, and pictures are even better. Tori is actually pathology, although normal, right? So unless it gets really out of control, Tori is typical, but it is a variant of normal. Medium rhomboid glossitis. And some of you folks are going to be doing some of these for your pathology projects. So this is going to be a really good kind of entry to that project for you. Radiographic, can we see something on a radiograph, right? So if there's periapical pathology or internal resorption of the tooth or impacted teeth, or sometimes there's cysts, we might need a radiograph or a CBCT or a pano to kind of help with us along with your clinical findings. Microscopic, this is becoming more and more prevalent. We'll see brush biopsies. We will see salivary testing, and all of those things happen and get, a lot more general doctors, general dentists are doing biopsies in the general office. But again, sending something off and getting a definitive diagnosis really needs to be done by an oral surgeon or a pathologist. Laboratory. So again, that laboratory, you might have culture testings. They might take swabs or saliva samples, and that will go to the laboratory for diagnoses. Therapeutics. So sometimes we don't know what it is, but we'll try to treat it. We'll give the patient antibiotics, and if it goes away, great. It was a bacteria. If it doesn't, then we can rule out that it was a bacteria. So sometimes by treating or trying to treat something, we will cross something off our list and get a diagnosis. Surgical. So again, sometimes the oral surgeon has to go in and remove it and then biopsy it. But even going in and removing it will give a lot of information by what it looks or what's on the inside. And then differential. So when two or more possible causes are identified, the dentist will determine which testing or treatment should be prescribed to rule out the incorrect diagnosis. So sometimes, again, you're comparing and contrasting. Inflammation is your body's way of saying, hey, there's a problem here, right? So it heats up, it swells. Inflammation can be chronic or acute, so long lasting or really short in duration. It can be, for acute cuts, sprains, breaks, gingivitis. For chronic, that gingivitis has gone on long enough that it becomes periodontitis. But classic signs of inflammation is redness, swelling, heat, and pain. So that's how we're looking for inflammation. Lesions too. Lesions is just a broad term for anything that's abnormal, right? So anything can be called a lesion. What we're looking at here is leukoplakia, which means a broad term for it might be benign, it might not. We don't know, right? It's right on that biting surface. So in our mind, we want to say, oh, it's just rubbing up against the teeth, and that lesion is just leukoplakia. We don't know, right? We don't know for certain, and sometimes we will still send them out for a biopsy, especially if they have oral cancer. That might be in the way of seeing an underlying lesion, or we're like, oh, we get used to seeing something in that area. We go, oh, it's nothing, it's just rubbing, and it ends up being something more. But we focus on four different types of lesions, really. We have erosion, which is a shallow injury due to mechanical trauma, such as chewing. We can have abscesses. It's a collection of pus, right, at the apex, right? So we can have an abscess coming out from the top of the tooth, or it could be coming out from a periodontal, right, at the gingival margin. So it depends where the abscess is to what might be going on. But it's pus, right? So when anybody has a fistula or an abscess, I ask them, like, have you been tasting something funny? Because literally pus, that infection is trying to get out somewhere, and it burrows through, and that's why that abscess is there. And it's usually bacteria. Then we have some cysts. Those are fluid-filled sacs. So sometimes, you can have an eruption cyst, which can be pretty normal, or cyst that is around the crown of an unerupted tooth, or cyst might be there and not be normal, and we don't know why the cyst is there. Sometimes with the 2D radiography, we can't tell if it is a fluid-filled or just an empty space. So again, that's why further testing needs to happen. Blisters are also called vesicles. They could be watery or fluid-filled, right? So like ulcerations should be gone within 2 weeks. Anything in the mouth should be healed by 2 weeks. Some folks might come in with a pustule and a hematoma, right? So you can see the person's bruising on her face right there. So bruising is a hematoma. But if you look right kind of in the center towards the top, there's a little blister. And again, that is pus. The infection needs to go somewhere, and it starts coming out the side of the mouth. I've seen a lesion like this. And these are the infections that can go to the brain, right? Our mouth is so close to the brain. And if this infection is just trying so hard to get out and drain somewhere, sometimes it leaks to the brain, and that can cause death as well. Plaques tend to be any patches or flat surfaces, right? It's not the same as dental plaque, right? We think on the teeth, right? Like our teeth are dirty, that mushy feeling on our teeth is dental plaque. Plaques on the tissue actually don't, wipe off, and they're slightly raised. Ecchymosis, you will see it's another term for bruising, usually in older folks, right? So their nutrition might be off, their vitamins and minerals might be off, their skin is very, very thin. So it doesn't take a lot to bruise, and then that bruise will spread very quickly. Nodules that you might see are, coming off of the skin. They are raised and solid. There's usually granular tissue in it, so it might feel like sand, but it doesn't feel fluid filled. It feels like there's something inside there. You might see neoplasms, and this is a medical term for a tumor. What does that look like in the picture all the way to the right? Right? So that's the palate of the roof of the mouth, palate. And at first glance, you think, oh, that looks like a tori. That patient must have a tori. But you can see the midline there. And this is kind of more to the left. It's not in the middle. So sometimes that is when it is unilateral, that is a red flag and must be checked, right? So this is a tumor and not a tori. So again, knowing what you're looking at can be so very important. Leukoplakia, like I talked about earlier, is a general term for white patch. It can occur anywhere in the mouth. It's not really painful. It can be due to chronic irritation or trauma, but we don't really know. Um, so sometimes these folks have to go get a biopsy just to rule out any kind of issue that's underlying. Lichen planus, you might see folks with autoimmune disorders get this lichen planus. We talked about it a little earlier, but there's white lace-like lesions. This person might have lupus, but the white lesions are called Wickham striaea. It's a very distinct pattern. Again, if I see this, I refer them back to their primary care for an evaluation of autoimmune disorders. And aphthous ulcers, oh, these are the worst. I took a 6-hour course on aphthous ulcers. They're canker sores, right? And after the 6-hour course, it was like, well, so we don't really know what causes them. Some people get them, some people don't. Acid makes it worse. So chocolate and orange juice and any tomato sauce, anything with acid in it is going to irritate it more. It could really stop the person from eating and drinking. And it might be recurrent. If it's recurrent, it might be a nutritional deficiency, a sign of that. But yeah, real pain in the butt there. You might run into candidiasis. Again, we've talked about this a few times before, but it might be the person might have diabetes or on antibiotics or dry mouth, weakened immune system. It's painful. It's also known as thrush or hand, foot, and mouth can cause this. And treatments include antifungal rinses or lozenges. So yeah, this you will see it's a fungal infection. Cellulitis, somebody comes in and their face is swollen or the tooth infection is so bad, part of their face is swollen. This is an immediate referral to the emergency room for IV antibiotics. This is usually a severe abscess and it's uncontrolled. They're going to have a fever and throbbing pain. They need to get to the emergency room right away for this. You might run into glossitis, which again is a lot of times a nutritional issue where you see it on their tongue. It's inflammation spots, so it's not geographic tongue. It's red areas, and this could be painful. It could not be painful. Sometimes I will ask them how their vitamin C and vitamin A consumption is. Changing their nutritional habits might help with that. Black hairy tongue, so gross. But this is when the patient's taste buds, all right, their filiform papilla become elongated and then stained by food or tobacco. So a lot of smokers will have this black hairy tongue, and it brushes off a little bit, but not so much. So again, this person needs to stop smoking and brush their tongue. Geographic tongue is a variant of normal. So we will see this and it moves around. So that pattern on the tongue will move around. So every appointment might look a little bit different. Some people say that this is painful because some of that filiform papilla, those taste buds are gone. So when they eat something spicy or acidic, then they could feel pain, but most people don't feel anything. You're going to run into fissured tongue, again, a variant of normal, but food and bacteria can be trapped inside the fissures. So you need to recommend, gently brushing them. The tongue scrapers really don't do much but pack the bacteria in. So taking a soft bristled brush and using mouth rinse is pretty helpful. Pernicious anemia, this is where the body does not absorb vitamin B. You can see it on the right here. They might have a smooth, glossy tongue. It might burn. They might have angular cheilitis on the sides of their mouth. It'll be just a shiny tongue. Really, this can be very painful. But again, nutritional deficiency. Oral cancer is one of the 10 most frequently occurring cancers in the world, and it is one of the only cancers that is on the rise. Um, and there are several reasons to why oral cancers are on the rise. And a lot of it has to do with the HPV or human papillomavirus. Um, but this is something that every single time a patient should be coming in, especially if they're getting an exam, the doctor should be looking, or the hygienist should be looking at the lips and the mouth, moving the tongue to the left and to the right, having the patient say ah, feeling under the tongue and the roof of the mouth, palpating certain areas, because that is how frequent oral cancer. And oral cancer, when someone gets oral cancer, it is debilitating. Can you imagine losing part of your jaw or your tongue and what that would affect? We all take these things for granted, but oral cancer is on the rise. And especially in our folks living in, and I've talked about this before, but living in retirement communities, because they age out of being able to get pregnant, these folks tend to stop using contraceptives and they end up with HPV or sexually transmitted diseases that become cancer. There's a big rise in oral cancer in men, and there's a lot of Michael Douglas came out. He had oral cancer. There's some um, Joey from oh gosh, I forget his name. He was on a sitcom. It'll come to me later, I'm sure. But a lot of celebrities have come out about this because it was becoming more prevalent, so they wanted to get the information out there. But every single time I see a patient, I do an oral cancer screening. There are different kinds of oral cancers. You might see carcinoma, right? So that's a malignant neoplasm of the epithelial tissue, so that specific tissue. It's going to invade the bone and connective tissue. It quickly moves to other regions of the body. It's going to affect the lip, the tongue, the cheeks, and the floor of the mouth. You might see sarcomas. Those are very, very bad neoplasms, and they will affect the connective tissue. It can spread to soft tissue. It's more rare than carcinoma. Anything that's a sarcoma is bad, bad news. Osteosarcoma means that tumor is infected into the bone. You can see on the x-ray here, that person's losing all of those teeth down there and most of that jaw, right? So there's going to be a lot of reconstructive. And then think about the eating habits and the healing after, um, and all that comes with that. Leukemia is cancer of forming in the organs, right? So it increases white blood cell growth. You're going to see this gingival hyperplasia. You can see just over the teeth, you can barely see the teeth because the gums are so inflamed because of the leukemia and the white blood cells. And again, we have so much, I mean, we have good bacteria, but we also have bad bacteria in our mouth, and our bodies are constantly dealing with that. So that's why we try to keep it as clean as possible. But our folks that don't keep their mouths clean, all of a sudden, when our immune system is focusing in on some other part of our body, and this is included with diabetics, right? Or their immune system is somewhere else, then they're going to, the mouth is going to start, all these bacteria are opportunistic and start taking over and growing. So again, having your immune system go out of whack. That's why we see a lot of things happen orally while it's happening in the other places in the body, because all of a sudden when folks are having flare-ups, we're like, what is going on? And it's not just in the mouth, it's somewhere else. You can have kidney issues, and we're seeing symptoms in the mouth. We go, okay, something's not right here. Most cancers are not painful in the beginning, right? So this is kind of the patients say, I don't really feel anything. But, unless, a lot of our pain in our mouth is because it's hit a nerve or something. And if it hasn't gotten that deep or to that point yet, they might not feel that pain. But warning signs include sores that do not heal. Like I said, everything should heal in the mouth. Within it's been there more than 2 weeks, it must be biopsied and diagnosed. If there's a lump or swelling in the lips, neck, or oral cavity, white or rough textured lesions on the lips or anywhere in the mouth, numbness in or around the oral cavity, dryness for no reason could be an issue with the salivary glands or tumors in the salivary glands, difficulty speaking, chewing, or swallowing, and repeated bleeding for no reason, right? And that's not gingivitis, right? Folks who, and that is an infection, but it's not oral cancer. But they'll have spontaneous bleeding. Patients are already scared to come to the dentist, so they will put off, or they're like, "Oh, I'm going in for my checkup," so they will put something off for months. And that's really early detection is really, really important. If somebody is diagnosed with oral cancer, some therapies include surgery or radiation, chemotherapy. They might end up having xerostomia because of those therapies, right? So as soon as I hear my patients going on any of those, I'm giving them prescription strength paste, whether it be Prevident or MI paste or any of the pastes that are out there that your office might be prescribing. I'll talk to them about Closes, rinse. I'll talk to them about Xylamelts. I'll talk to them about all the products that help prevent dry mouth. There's all day spray and gel, which is by a company I really, really appreciate. Maybe some of you guys will did your products on that last semester, but there are some really great dry mouth. I'll increase the fluoride. I'll bring them in every 3 months for a fluoride varnish or a POV1 iodine and send them home with that. But these folks might, because of chemotherapy, they're at a higher risk for mucositis and ulcers and that dry mouth and delayed healing, right? It is not comfortable. It is terrible. So really, we try to make them as comfortable as possible. And a lot of times our folks they're going on liquid diets, right? So we try to think of that nutrition. They're not going to be able to consume or eat salads or vegetables like that. So there is some really great nutritional information at maybe I'll try to retrieve it from the periodontist office that I teach a class with once in a while. But they have like a really in-depth nutritional plan where you can blend some things. There are some over-the-counter nutritional shakes that you can have while going through this. HPV again appears so commonly, especially in immunocompromised people. You can see it here. This is HPV on the tongue. This is the lateral border of the tongue. It's got long finger-like projections. It almost looks like a wart. It's spiky. It might look cauliflower. I've seen this on the tongue. I've seen this on the roof of the mouth. As soon as I see this, I know exactly what it is. They need to go have it biopsied. And when they biopsy, they'll try to remove the whole thing. But this is HPV. Okay. So you guys know I'm a proponent of vaccines. I think it is so important because now they can give a vaccine to, I think it's in 2 or 3 doses. When for our teenagers, they get that. And this is lifelong. This is going to help prevent the HPV when they're older. So it's not to protect them almost immediately then, right? Because hopefully they might not be doing those activities, but it's going to help them when they're older getting that vaccine so they don't contract this virus and have it lay dormant until it starts really causing some problems. So I hope you guys don't see some of these pathologies, but you just might. There's other complications as well with radiation therapy. Again, that dry mouth, and we just know when our patients are going through radiation, they're just such a higher risk getting cavities and having those cavities spread, and osteonecrosis, right? So this is bone death. So TMJ or death of the bone, having an extraction and that bone dies around it, and then all of a sudden, again, they're losing their mandible because of that radiation treatment. There are a lot of screenings that we can do in office, and you might see your doctors or the hygienist doing this. This is early detection, so there's oral ID or valve scopes. There's quite a few of these on the market now. A lot of them have to do with a light, so it'll look at the densities of the tissues And if the tissue is dense, if it lights up, that is super dark, then they know that might be a collection of tissue underneath. You can see from in the center picture there, it doesn't look like anything on the palate, but when you light it up with the valve-scope, it can see that density of tissue, and that person needs to be referred to an oral surgeon. So these are, have come and go in popularity with offices. I feel like offices sometimes will use this to make money, or certain, they'll charge patients for it. Some do not. So it really just depends on your office. Not all offices have this, but anytime you're doing a screening, or the doctor or the hygienist, it needs to be documented. Some of these will take photos as well. So you see, there's like an attachment to the valve scope, and then you can take a picture, and that's part of the patient's legal document. There are some developmental disorders, right? So congenital is at birth, or is inherited, or developmental, but there is an abnormal gene. So a lot of times, when I have a patient, their mouth will reflect, usually mom's side or dad's side. Folks that have Down syndrome will have some developmental disorders. Folks that, if the mother had syphilis, they will have developmental genetic disorders. So you will see that cleft palate and cleft lip can happen. So guarantee that this will be on a quiz or midterm, or your final. But you need to know the difference between cleft lip and cleft palate, because that will be on there. So cleft lip occurs when the maxillary and medial nasal processes fail to fuse. Cleft palate occurs when the palatal shells fail to fuse in the primary palate, and it can be hereditary or environmental. Both of these can have long-term effects if not treated, multiple surgeries to treat it. You can see the differences, though. These surgeries, it almost looks like now it's all undetectable that they even had it, or a slight scar there. You see this untreated in a lot of underdeveloped countries, and it is so very sad, because not only can these folks, especially when they're little, have a hard time eating or sucking or swallowing, and there are prostheses that you can put in. It almost looks like a partial denture, or almost like a palate expander, and it'll block that airway so that they can breathe correctly while waiting for surgery or swallow. But cleft lip and cleft palate can happen. Ankylosis, so again, tongue-tied. This is a huge problem, and this can create a lot of airway issues. So just the way the patient is breathing, a lot of times it's because that palate is not wide enough, or you can see here ankylosing tongue tie, right? So that tissue is restricting that tongue from moving. You can have a front tongue tie or even a posterior tongue tie. If you open your mouth, you should be able to raise the tip of your tongue to the roof of your mouth and have it touch the top of your mouth. If you cannot, you might have a tongue tie. If it's severe, babies can't latch when breastfeeding, or have a hard time eating or drinking. And with adults, it can give, or even children, it can give speech impairments. But it can tie the whole body. That fascia is just too tight, and should be clipped or lasered. This is a whole class that you can take. Myofunctional therapists can also teach a patient how to release these muscles in the mouth and retrain the muscles after having that frenum cut. You can see here, there's some, we're almost done, folks. Hang in there with me, last few slides, but you can see some developmental disturbances. This is just malocclusion. Not only is it dirty teeth, I want to clean those teeth. That's a class 2 up in the upper left-hand side, with a patient with a flare over an overjet. They might have been a thumb or finger sucker. tori on the bottom here. We really don't do anything for tori unless it's like touching, like kissing, and then and really disrupting the patient because removing that bony growth is such a painful like healing process. And then we've got underbite here. So that patient, that class 3 pragmathic bite, sometimes those patients need their jaws broken to reset their bite. And if not, I mean, that bite can destroy their TMJ and the teeth as they get older. You might see extra teeth. You can see down in the lower right-hand side, supernumerary teeth, right? How many premolars are there? You might see dens and dente, which is extra teeth inside of teeth. You might see dilacerated teeth or teeth that it's two teeth in one root or two teeth fused together. So those are all different developmental disorders. Here's a good picture of abrasion, right? So that person might be brushing too hard, the upper left-hand side, wearing away some of the enamel. You also have to rule out clenching and grinding and high acidity. On the lower the lower left-hand side, you also see erosion from lemons or limes in an acidic environment. And in that big picture is erosion from bulimia. You can see that the acids have worn away at that posterior teeth, all of the linguals of the teeth. The enamel is just eroding away. And right in the center there, yep, that is a hole. The acid eats a hole right through the palate, and that'll go into their sinuses and nasal cavity. Again, these are classic signs of bulimia there. Attrition, this person has an edge-to-edge bite. Some folks that have high anxiety, clenching, grinding, or malocclusion, that attrition will wear down the teeth. And you can't just do a crown, right? You're like, oh, just put a crown on there. No, because the crown is stronger than the natural teeth and it'll wear it down even more. You have to fix the bite before putting any kind of restorative on here, or the restorative will just keep breaking down. Bruxism, so signs of clenching and grinding. And again, a night guard is just a Band-Aid. If we're giving our patients night guards, we have to figure out what the root cause is of the grinding. Is it airway obstruction? Is it malocclusion? What is going on for them to be clenching and grinding? Sometimes it's just stress, but most of the time it's something differently. Piercings, they can chip teeth. I've had my tongue pierced, my chin pierced, my lip pierced, like all these things. And you can see the wear on the chin piercing there, the tissue to 24 and 25. Those teeth will get loose and come right out. Same thing with the tongue ring, chipping of the teeth. This was really cool back in the day. But as soon as I see my patients with any kind of oral piercings, they are destroying their bone and tissue. Even the Madonnas or surface piercings, it rubs constantly against that bone, and eventually the tooth will get loose and fall out. I tell them to take it out. It's not worth it. Not worth it. That trend is not worth losing your teeth. We've talked about meth mouth a few times. You will see patients coming in usually when they're in recovery because their teeth have taken such a hit that they're trying to rebuild their lives and they need teeth to even get a job, right? So this is a big part of it. And they might be candid with you on where they are in their recovery, but a lot of times they're coming in pain if they're currently in addiction. And I can tell, or you can tell by the class 5 decay all the way across. Not only is the methamphetamines acidic, if they're smoking it, it's highly acidic against their teeth, but these folks crave sweet, sugar, usually gummies or anything sugary, high sugar drinks. And that is contributing to this decay and erosion. To college students that are taking Adderall, methamphetamine, right? They're gonna not eat, and then crave sugar. You can see this is really sad here. This picture, this person is 18 and they were on meth, in a picture at 25, both of these mug shots. It's just so debilitating. And these folks, again, if they're coming in, if they're in recovery and trying to change their life, their teeth might be that first step in that recovery. All right, so you guys got a whole lot of content in today. So have a really great snow day. Please make sure you watch it. Be prepared for your exam. Look for correspondence. Please look at your announcements for this class, and we will continue moving forward.